Welcome friends to CNS Viewpoint. Today we are going to talk about a very important report which has come out from World Health Organization. It is called Air Quality Guidelines. The World Health Organization has issued these WHO air quality guidelines after 16 years. The last air quality guidelines of WHO were issued in 2005. This is 2021. So in 2021 September guidelines of WHO on air quality, the most important and striking fact is that WHO has reduced the maximum level of pollutants in our air. So, in other words, if I have to say this, in 2005 the maximum level of those dangerous, death-causing, disease-causing pollutants like particulate matter 2.5, particulate matter 10, ozone, carbon monoxide, nitrogen dioxide, sulfur dioxide, all these six was much higher, which was considered as a safe, like the maximum limit permissible in the air. But though even at that level, these pollutants were causing death, diseases, and this is not something desirable. In 2021, those maximum limit of these dangerous, death-causing, disease-causing pollutants has been lowered, has been brought down, so that people can breathe in clean air which is not causing preventable diseases and untimely deaths. So this is extremely very, very alarming, friends, because most of the countries where we live in, most of the air quality has deteriorated. Cardiovascular diseases and respiratory diseases are some of those illnesses which we deal with. For example, heart disease, stroke, asthma, neurodegenerative conditions, even diabetes is linked to air pollution now, and pregnant women, children, senior citizens, they are particularly have been identified as to be at higher risk. So what are the new levels? The new levels, friends, is particulate matter. As you know, particulate matter 2.5 is the most dangerous. Particulate matter is solid or liquid droplets, and these enter into our lungs because they are so small, even smaller than 10 microns or micromillimeters, or 5 or 2.5 microns. So they enter our lungs, and 2.5 ones or even smaller ones or ultra fine particles, they even enter our bloodstream, friends. This is very, very dangerous, of course, and that is why WHO and health authorities are very alarmed. And that is why International Agency for Research on Cancer of the World Health Organization has classified air pollution and particulate matter as carcinogenic, because these are cancer-causing things. So PM 2.5 levels has been halved from 2005 level. So the danger level of PM 2.5 in 2005, which was 10, is now 5. PM 10 from 20, it has been brought down to 15. So imagine, so there has been drastic reduction at the level. Similarly, if you look at the level of nitrogen dioxide has been brought down 10 times than the danger level which was identified in 2005. So in 2021 it is 10, in 2005 it was 100. Sulphur dioxide from 100 it is 40, carbon monoxide 4, and ozone 100. So this is very, very alarming, friends, because the kind of development model which our governments are chasing and which we are part of, we are also chasing in many ways, or we are at least contributing definitely. That it is leading to a more polluted planet, and it is also leading to a misconception that the more we pollute, the more successful we are. So if you look at the lifestyles of the urban people, they need much more the kind of life to maintain or sustain that kind of lifestyle. We have to be honest about it, that they will be polluting much more than or causing harm to the environment much more than the harm which is caused by people who live in rural areas. So for example, farmers, and we all know that farmers are doing much better job because they are producing food, they grow food which sustains life compared to the kind of work I do, if I stop working, no life is dependent on me. But if farmers stop working, then you can imagine what are we going to eat. So, but we are making it is more and more difficult for people who are leading relatively more sustainable lifestyles, and forcing them to come to cities and opt for polluting ways of living. So, for example, we are forcing people to buy motor vehicles, and not use public transport, because the condition of public transport in the country I am currently in is so pathetic. It has been historically so appalling. At least for my lifetime, historically, I mean by that. So people who buy new cars or new motorcycles or scooters or motor vehicles, it is considered to be an achievement, and they have to take bank loans or spend their family income or savings to do so. But having a strong, better public transport for rich and poor alike, for each one of us, is still a very elusive dream in countries like India. In some cities, the situation is a bit better than others, but by and large, you can safely say that the public transport is very, very bad in India, and no wonder that a major industry is the motor vehicle industry or automobile industry. Governments should hold the abusive extractive industries to account, make them pay for the damage they have caused to human health and to the health of our planet. Promote not market-based false solutions, but solutions that are ecologically sustainable, that are socially just. And of course, you and I need to live a lifestyle, and have income generation activities which are as less polluting as possible, as much sustainable as possible. That has to be our two-bit contribution to the effort, which have to be primarily led by the government. It is not about individual choices you and I are making, because it is much more bigger responsibility of the government to ensure that you and I are breathing in clean air, which is not disease causing, which is not untimely death causing. No matter which country we live in, no matter which place we live in, no matter whether we are rich or poor, or which community we come from, or what is the color of our skin or gender. So with these words, I will again like to remind you to go and have a look at our previous CNS Viewpoint, which was on the August 2021 Chicago University's Energy Policy Institute Air Quality Report, which had stated that 40% Indians are going to lose their average life expectancy by 9 years. And the worst affected states were Uttar Pradesh and Delhi. I am currently in Uttar Pradesh, and in Uttar Pradesh, for example, in that report, the particulate matter was reported to be the worst in India. All across the cities of Uttar Pradesh, for instance, many cities had high PM2 particulate matter levels, as high as 7 to 8 times than the 2005 limit. And you and I have just heard and read in the WHO new 2021 air quality guidelines that these upper limit, that this is the danger mark for PM 2.5, danger mark for 10, danger mark for ozone, danger mark for sulfur dioxide, nitrogen dioxide, and carbon monoxide. All these danger levels have been brought down, because the pre-2005 levels, even at that level, these pollutants were causing diseases and deaths, and of course damaging climate. So let's hope sanity prevails. Let's hope we do not, we are not contributing towards looming climate crisis. Let's hope we are able to take steps which are so warranted in time. Time is running out, friends, to save our planet, to save our climate, to save our environment. We need air. We need clean air, not deadly air that causes diseases and deaths. We need life-nourishing water, life-nourishing air, life-nourishing food, not fortified food propelled by industries for example, synthetic food or synthetic meat. So coming back to the report, please, I will encourage you to go to the who.int, the WHO website, download this report, and or if you can, and try to read the report, or at least try to go through its executive summary. Another very important thing which I learned in this report was that all these 6 deadly pollutants, they have listed out the causes of these pollutants. One of them is, of course, the biggest is the fuel combustion, which happens in automobiles, which happens in industries, which happens in homes too at times, which happens in energy production. It also happens in agriculture. So there's a lot of action points. The governments have to prevent preventable diseases and untimely deaths, and there is no excuse for inaction anymore. And we need real solutions for climate, not false solutions like electric cars or other kind of false solutions. We need sustainable lifestyles which are socially just and ecologically sustainable. With these words, I will conclude today's CNS Viewpoint, and we'll meet again tomorrow 5 p.m. India time. Bye bye till then. Stay safe and stay healthy and breathe in clean air, hopefully.